Hi, it's AskDrParthaNandi from AskDrNandi, and today it's a beautiful wintry day. It's several inches of snow, freezing rain, and also amazingly cold weather. It's a perfect opportunity to talk about something that's quite serious, which is frostbite. So frostbite happens when there's freezing of the skin underlying tissue. And it can happen most commonly in the nose, the ears, the chin, the cheeks, and the hands and toes. So there are several stages of frostbite. First of all, frost nip. And in this stage, you can have some redness of the skin. And if you keep exposure to the cold, you can have this kind of a prickly sensation. At this stage, you don't have any permanent damage. But as you progress on, that can change. You can have superficial frostbite, which is the second stage. And at this stage, the skin can become pale. You can actually have ice crystals form on the skin. And then the skin becomes warm. When the skin feels warm, that is a sign that you can have some serious skin involvement and possible damage. Blisters can form after rewarming. Now, after superficial frostbite, you can have severe or deep frostbite. In this stage, it can be quite serious. Your skin can actually become numb, and the joints and muscles no longer work. If you rewarm the skin at this point, you can get large blisters, and then you have skin death, with the skin actually becoming black and then dying. So quite a serious stage of frostbite. So remember, frost snip, superficial frostbite, and then deep frostbite. So when do you see a doctor? When do you have to see a medical professional? Obviously, if you have any signs of superficial or deep frostbite, important to see your doctor. Also, if you have any pain, redness, if you have fever, increased warmth, all those are signs that you should see your doctor for treatment. So who's at risk? People say, Dr. Nandi, is everybody at risk for frostbite? Really, everybody is at risk for frostbite, but some are especially so. If you're dehydrated, if you're exhausted, if you're diabetic, if you have poor flow to the limbs, if you're also an infant or an elderly person, you're at increased risk for frostbite. But remember, everybody's susceptible. So what really causes frostbite? Mainly it's exposure to the cold for a long period of time. Cold, wintry conditions. Also touching an object that's very, very cold, as well as very cold metal objects, can also result in frostbite. Now, what can we do to prevent frostbite? Right, we've been talking about it. What can we do to prevent it? The main thing is that try to limit your exposure to cold, windy conditions. If you have to go in the cold, remember to wear several layers of loose, warm clothing. Wear a hat or headband that covers the ears. Wear mittens, socks, and sock liners. Very important to prevent frostbite. So, during the wintry months, you can still have some fun. But remember, get educated. Be your own health hero. Become an advocate for your health care and prevent frostbite. Thank you for watching.